Penn State Health is partnering with area businesses to make sure their employees can conveniently access the health care they need to stay happy and healthy. We're here to talk about the new Commpanion program that does just that is Dr. Daniel Schlegel. He is Medical Director of Virtual Primary Care at Penn State Health. Nice to have you with us here today. So I'm going to throw some questions at you. You know, the last few years it really impacted not just employees, employers, and we know that a healthy workforce is a happier workforce. Why is it so important that people take time out of their busy schedules and really prioritize their health?
Yeah, you're right. In order to be a happy and productive employee, you need to be a healthy employee. And employers care a lot about their employees' health. They want them to be healthy. But the thing is, although employees might have health insurance, what they don't always have is time in the day to see the doctor. It's hard in the middle of a busy day to schedule a doctor's appointment, to drive to it. So employees often don't get the care they need when they're sick, and they don't get the preventative services that they should get, like blood pressure checks, cholesterol checks, to keep them healthy.
That is tricky because you feel a little bit guilty if you sneak out of work to go to a doctor's appointment, go to a checkup. So what is Penn State Health's new Commpanion program? Like, how does that work?
Yeah, we're really excited. So this is really about convenience and access for employees, who are becoming our patients. So we're combining two things: telehealth, video visits, and we've gotten really comfortable with these over the past couple of years. We've seen that we can really deliver good care through video visits, but some people feel like they're kind of impersonal. So the other part of this is that we're doing membership-based access to primary care. So an employer or a sponsor pays for the employee to have access to the primary care practice, and with that they get as much care as they need. If we need to do 30-minute visits, 60-minute visits, as many of those as they need, as many phone calls and as many messages in between visits as we need to keep the patient healthy. So that really supports the relationship that you might feel is missing in the video visit.
That's so interesting. Now, you've been doing this doctor thing, right, for 16 years. What makes you excited specifically about this Commpanion program?
Yeah, this really is great for me. So I got into family medicine because I wanted to get to know my patients well and help them out, but there's so many barriers to care that my patients experience. And what I love about this is that we're really eliminating barriers to care. I like to say that we're practicing medicine without walls, and we're getting rid of the real walls, because this is not brick and mortar, this is all virtual. And what that means is there's fewer barriers between the patient and the provider, and also between the members of the healthcare team. So the barriers the patients experience are distance and time of day, right? It's hard to drive to the doctor's office. It's hard to make time in your day to schedule that appointment. But when you're doing the visit from your kitchen or from your job site, that barrier goes away, right? There's no drive time at all. And since we have expanded hours, because we're virtual, it's easy for patients to find time when they can get in to see us. So we're really eliminating barriers.
Honestly, that seems like it's really beneficial for both the patient and the employer, because the patient, just is off the clock just for a very short amount of time. There's no drive time or anything like that. Right. Why is it so important to break down these barriers?
Yeah, we really want, because both patients and employees want, or employers want our employees to be healthy and happy. Yeah.
What about people who are still skeptical about virtual visits? Because believe me, before the pandemic, I was one of them. I'm always slow to any technology, but I thought, no, you have to be able to see your doctor. The doctor has to be able to see you. So people are still like, I don't know.
I completely understand that. I hear about that from my own family at our Labor Day picnic this past weekend. I get that. There really is something to be said for, laying on hands, for doing the physical examination. But you think about the kind of problems that we manage: high blood pressure, diabetes, high cholesterol. It's much more about the conversation than it is about the examination. And what we can do is, in the exam room, I can't do this in my physical exam room, but in my virtual exam room, I can get my patient connected to a social worker, to a mental health counselor, to a nutritionist, to a dietitian virtually.
Wow.
So they can get access to the whole care team. And I think that benefit really outweighs the downside of not having the in-person visit.
Oh yeah, sounds great. Thank you so much, Dr. Schlegel.
Good
to have you with us.